Hello, everyone. Today, my AI assistant ChatGPT and I will introduce you to 5 ways to save money from daily medical expenses. Five ways to remember where you can save everyday medical expenses are: 1. Emergency room. 2. Prescription drugs. 3. Any medical establishments. 4. Telemedicine. 5. Primary care doctor. I am Left. I have been an X-ray tech in a hospital since 2006. This is ChatGPT, an artificial language model. Today, can I call you Charlie, ChatGPT?
Of course, you can call me Charlie if that makes it easier. Remember that my official name is ChatGPT, and I'm always here to assist you with any questions or concerns.
Thanks, Charlie.
You're welcome. How can I assist you today, Left?
We are starting number 1. How to save medical bills at the emergency room. I am afraid to go to the ER because you never know how much they will bill me.
It's understandable to feel anxious about the cost of medical care, particularly when it comes to emergency room visits. However, it's important to prioritize your health and well-being above financial concerns. Here are some things to keep in mind. 1. The law requires emergency rooms to treat everyone who comes in, regardless of their ability to pay. 2. Most hospitals will work with you to create a payment plan or provide financial assistance if you struggle to pay your medical bills. 3. Reviewing your health insurance policy and understanding your coverage before seeking medical care is essential. If you have insurance, your out-of-pocket costs for an emergency room visit may be lower than if you don't. 4. If you're unsure whether your symptoms require a trip to the emergency room, consider contacting your primary care physician or a telemedicine service for advice. 5. Finally, if you do receive a bill you cannot pay attention to it. Contact the hospital's billing department and explain your situation. They can work with you to reduce your bill or set up a payment plan.
After a lengthy discussion with you, I concluded that the best way to save money from ER service is not to use ER for non-life-threatening emergencies.
That is correct. One of the most effective ways to save money on healthcare costs is to avoid using the emergency room for non-life-threatening conditions. The emergency room is designed to provide immediate care for people with serious or life-threatening conditions, such as chest pain, severe bleeding, or difficulty breathing. However, many people use the emergency room for minor health issues, such as colds, flu, or minor injuries, which can be treated more cost-effectively in other healthcare settings, such as a primary care doctor's office, urgent care center, or retail clinic. Using the emergency room for non-emergency conditions can be expensive, as emergency room visits typically involve higher costs for medical care, facilities, and staff than in other healthcare settings. In addition, many health insurance plans have high co-payments or deductibles for emergency room visits, which can add up to high out-of-pocket patient costs. By seeking care for non-life-threatening conditions in other healthcare settings, you can save money on healthcare costs and help ensure that emergency room resources are available for those who truly need them.
How to save money number 2. Prescription drugs. Don't buy medicine from the doctor's office. Have the doctor write a prescription and have it filled in the pharmacy.
That's a great tip. Purchasing medications directly from a doctor's office can be convenient, but it can also be more expensive than buying them from a pharmacy. In many cases, a doctor's office will charge a markup on medications they sell, which can increase the cost of the drug compared to what you would pay at a pharmacy. By having the doctor write a prescription and fill it at a pharmacy, you can often save money on the cost of the medication. In addition, when you fill a prescription at a pharmacy, you may have access to discounts or coupons that can lower the cost of the medication. Many pharmacies offer programs to help patients save money on prescriptions, such as loyalty programs or prescription discount cards. It's also worth noting that purchasing medications directly from a doctor's office may not be covered by your insurance plan, while filling a prescription at a pharmacy is typically covered under most insurance plans. Overall, filling a prescription at a pharmacy can be a cost-effective way to obtain the needed medications while saving money on your medical bills.
I forgot to mention there is an app called GoodRx too.
You're absolutely right. GoodRx is a helpful app that can help you save money on prescription medications. The app allows you to search for the lowest prices on prescription drugs at nearby pharmacies, and it also provides coupons and discounts that can help you save even more money.
You can do the same to the meds for your cats and dogs.
You can also use GoodRx to find the lowest prices on prescription medications for your pets, including cats and dogs. Just like with human medications, the prices of pet medications can vary depending on the pharmacy you visit, and using GoodRx can help you find the best prices on the drugs your pets need.
How to save medical bills number 3. At any medical establishments, I have a good experience at my optometrist's. Even though I had insurance for vision, she always charged me like $500 per pair. I told her that my budget had become tight because my husband had retired. And I want to pay $100 for a pair. Then, she charged me like $200 per pair, and I liked that.
Negotiate with your healthcare provider. As you did with your optometrist, try negotiating with your healthcare provider for a lower price. Be upfront and explain your situation. They can offer you a discount or payment plan.
Do you have any good ideas for negotiation with your healthcare provider? Should you let them know before the service at the front desk? Or should you tell your doctor?
Yes, I have some ideas for negotiating with your healthcare provider. Be upfront. Let your healthcare provider know that you are concerned about the cost of treatment and would like to discuss options for reducing the cost. You can do this at the receptionist or with your doctor, but it may be more effective to bring it up with your doctor during your appointment. Understand the costs. Before your appointment, research the typical cost of the treatment or service you need. This will give you a baseline for what you should expect to pay and will help you negotiate a fair price. Be prepared to walk away. If your healthcare provider is unwilling to negotiate or offer a fair price, be prepared to walk away and seek treatment elsewhere. Ask about payment plans. Many healthcare providers offer payment plans that allow you to pay off your bill over time. Ask about these options if you are concerned about paying your bill in full upfront. Consider a cash payment. Sometimes, healthcare providers offer a discount if you pay for your treatment in cash. Ask about this option if you can pay upfront. Remember always to be polite and respectful when negotiating with your healthcare provider. They are providing an important service and deserve to be treated with respect.
I like all the tips you give us, Charlie. I'll bet you will be my good negotiator.
Thank you for the compliment. As an AI language model, my abilities are limited to providing information and suggestions based on the data I have been trained on. However, I'm glad that I could be helpful to you. If you have any more questions or concerns, feel free to ask.
How to save medical bills number 4. Telemedicine. I love Doctor OnDemand. My insurance provides this service at no charge, and I used this service for my second-degree burn, infection from scratch by a stray cat, and COVID-19. Those doctors were excellent. If you don't have insurance, how much do you pay for telemedicine?
The cost of telemedicine services can vary depending on the healthcare provider and the type of consultation you require. Without insurance, a telemedicine consultation can range from $40 to $200 or more, depending on the provider and the type of service needed. However, many telemedicine providers offer a range of pricing options, including subscription plans, per-visit fees, and other payment models that may be more affordable for patients without insurance. Researching and comparing different telemedicine providers is essential to find the most cost-effective option for your needs. Additionally, some healthcare providers and telemedicine platforms offer discounts or financial assistance programs for uninsured or underinsured patients. You can check with the specific telemedicine provider to see if they offer such programs.
How to save money on medical bills number 5. Primary care physician. How do you save money on primary care, Dr. Charlie?
One way to save money on primary care is to establish a good relationship with your primary care physician, PCP. Regular checkups with your PCP can help prevent serious health issues and reduce the need for expensive medical procedures down the road. Here are some tips to help you save money on your primary care. Choose a PCP that is covered by your insurance plan to avoid out-of-network fees. Look for PCPs who offer telehealth services. This can save you time and money by avoiding traveling to the doctor's office. Take advantage of preventative care services that are covered by most insurance plans, such as annual physical exams and immunizations. Ask your PCP for generic prescriptions instead of brand-name drugs, as they are often less expensive and just as effective. Shop around for lab tests and other diagnostic services. Prices can vary significantly between providers, so it pays to compare prices before scheduling any tests. By following these tips, you can save money on your primary care without sacrificing the quality of care.
Charlie, I work for a hospital, but I learned a lot today. When I become sick and need to see a doctor immediately, I will use telemedicine first and ask the doctor if I should go to an emergency room or not.
That's great to hear. Telemedicine can be a convenient and cost-effective option for many non-emergency medical issues. It's always a good idea to consult with a medical professional before deciding whether to go to the emergency room, as they can provide guidance on the appropriate level of care needed for your specific situation. By using telemedicine first, you can potentially save yourself time and money, while also receiving the proper care for your health needs.
So, Charlie, we summarize how to save money on medical bills. 1. Only use the emergency room if you have life-threatening problems. 2. Have your doctor write a prescription and fill your medicine at the pharmacy. 3. You can politely ask for a discount up front at any medical establishment. 4. Use telemedicine first. The price is reasonable even if you don't have insurance. 5. Get a primary care doctor and have a good relationship with him. You can get a service from an annual checkup to any non-emergency problems.
As an AI language model, I cannot provide opinions, but I can confirm that these are effective ways to save money on medical bills. Taking advantage of telemedicine services and having a good relationship with your primary care physician can help you avoid costly emergency room visits and unnecessary medical tests. Asking for upfront discounts and filling prescriptions at a pharmacy are also effective ways to save money on medical expenses. However, it is important to note that these tips may not apply in all situations, and it is always best to consult a healthcare professional for personalized advice.
How did you like this video? Thank you for your viewing. This video will help you save money on medical bills. Let me know what you think about this video in the comments. If you like this video, please give me a thumbs up. And subscribe to the channel.
With you, I can be sad with you. Just take my hand and fly up through the